Doctor.
Hi.
Okay, I have a very interesting guest with me today. She is Dr. Surinder Arora. She's the only dentist that I know that does Homeoblock, and we will talk more about it later. But what it does in a nutshell is that it improves airway restriction. So she's the only one that does it in Singapore. And she has a Bachelor of Dental Surgery degree in the UK, and she's also a board member in quite a number of academies and institutes. And definitely she's also trained in nutrition, which is great. So I'm going to ask you a few questions, okay? You see your role as a dentist is to put the mouth back into the body. So can you explain what you mean by that?
Yeah, absolutely. I mean, we are multi-dimensional, multifaceted beings. So as a dentist in my early years of my career, it's like looking at the mouth, but now I really connect it to the rest of the body. And that can look like anything from the type of materials inside the mouth, dental nutrition, airway and breathing, which is something we'll touch more upon today, and are there any infections and how that's affecting the rest of the system. So I dive a bit deeper into that. We also look at social factors, aesthetic factors as well. That's also something that we consider, environmental factors, especially with the allergens that we have in the air nowadays, coming back to breathing and airway, so it's really like a holistic approach.
Yes, definitely. But what made you do something so different from conventional dentists?
So I would say I went to an excellent dental school in the UK, but I always felt like something was missing and there was more to learn. So it was really postgraduate that I started exploring. Some of it was spiritually, some of it was nutritionally. I trained as a health coach, I studied in Reiki, and then I started to bring all of this stuff into the clinic. And lo and behold, I found that there were disciplines around such as biological dentistry, holistic dentistry, which really brought different elements into the clinic.
But all these things seem like some kind of a rabbit trail, and suddenly it all kind of coalesced together into some form of dentistry that you're practicing now, right?
Yeah, so I would say that for me, it was really an exploration. So I was exploring different areas, and then I stumbled upon there are actually bodies doing this kind of thing already. So then I did further training in many different areas of dentistry, and it's never ending. I have to say, the more you know, and in your field as well, the more you know, the more you realize there is to know and to learn.
I mean, for us practitioners, you know, the more we find out, the more we know what we don't know.
Yeah.
And the more we want to find out more.
Exactly.
And it just goes deeper and deeper and deeper. And you don't know how deep it's going to go.
You don't.
You just follow the trail and hopefully you see a light at the end of the tunnel. Yeah. Okay, let's also look at the orthodontic landscape.
Yeah.
Because it has changed a lot.
Yeah.
When I was a kid, I wore braces myself.
Yeah.
But thank God I didn't remove any teeth.
Good. Good.
But I wore my braces for a couple of years, and let's fast forward 20 years later, and my son, he has a bit of crooked teeth. So my dentist got him to wear trainers and tried to grow the palate.
Absolutely.
So I felt that it was very different from what conventional orthodontics was to pluck out teeth, and after that wear braces to rearrange it. But after reading a lot about it, and also now that you've also spoken about it, that it actually causes quite a lot of issues. You want to talk about how this landscape has changed and what you feel was the disadvantages in the conventional orthodontics and what is happening now?
Yeah, so I mean, conventional orthodontics is still there, very much so. Many people still take out teeth to make space inside the mouth. So if you've got a crooked teeth, sometimes it's like there is not enough space, so teeth are taken out. The issue with this approach is that when we take out teeth from the arch, we bring teeth back and we lose space inside the mouth. When we're losing space inside the mouth, we are compromising the airway. Several ways. So one way is the tongue is pushed back into the airway, and that back of the tongue, so the tongue is actually a huge muscle, and we don't see all of it, we just see what's kind of external inside the mouth, but there are a lot of muscles attached there. But if that's spilling back into the airway, you're going to get airway constriction. If we're taking out teeth, again, you've got less space in the maxilla. The maxilla is the top of the mouth. The top of the mouth is the floor of the nose. So again, the breathing in the airway is compromised. It can be compromised. And I see a lot of adult patients now that have had teeth taken out that have airway and breathing issues.
You said something very important. The top of the mouth is the floor of the nose. So a lot of people don't understand, like you get sinuses. Let's say you have all sorts of breathing, like mouth breathing. You got to look at that very carefully and find ways of actually improving on that situation. And that's why we're having this conversation now.
Absolutely. I think it's wonderful that your son is wearing trainers because the myofunctional therapy is crucial. For me, taking a whole person approach, it is really crucial because if we can train the muscles to work correctly, the tongue on the roof of the mouth, this is absolutely essential for good airway and good breathing, you're off to a great start with your kids.
Now the next question is, because this is for kids, because they're at the growing age, the maxilla can still grow, you know, but for adults, how do we go about helping adults to actually expand their airways? Because for me, my clients, why we're having this conversation in the first place is, I see a lot of clients with TMJ, bruxism, cracked teeth, you know, and sleep apnea. These are all just symptoms of a problem. And the problem is actually airway restriction, because when you have airway restriction when you sleep, your body goes into fight or flight
That's
mode.
it, sympathetic,
Your sympathetic nervous system is switched on all the time. Then you get your secondary breathing mechanisms all tightened up. You get headaches, blood pressure goes up. And not only that, your lower esophageal sphincter starts to relax because of the fight or flight syndrome. And then you get low-grade acid reflux, causing you to have damaged teeth. These are just symptoms of one major problem, which is airway restriction. So for adults, how do we help a person like that?
So I think something very simple that everyone can check at home right now is, where is your tongue sitting in your mouth? So if you just check in with yourself, and you might never have thought of this before, but where is your tongue sitting in your mouth? The tongue ideally should be rolled up to the top of the mouth, to the palate. So the whole of the tongue should be stuck against the roof of the mouth. So if you say the letter N, and the tongue rolls up to the roof of the mouth, that is where it should be at rest. This is one of the, I wouldn't say easier, but one of the more obvious ways to try and help with the airway and breathing. Because in getting the tongue to the roof of the mouth, we're toning the tongue muscles and getting the tongue a little bit more out of the airway. But honestly, there are many different reasons that things like this could be happening. People come in with snoring issues, everything that you've just said actually, TMJ issues, bruxism issues, snoring, sleep apnea. So it really depends on what's happening. So we look at the lifestyle first. Lifestyle, weight, food, exercise, movement, habits. So thinking about habits, we work with people like yourselves. So just maybe adjusting or helping to release muscles, that can be very, very beneficial in adults and in children.
Talk about habits. What sort of habits, like sedentary lifestyle, that can cause you to have airway restrictions?
With regard to a sedentary lifestyle, well, if you're not moving your body and you're not kind of using your muscles, you're not going to be having good oxygen and breathing. And the other aspect is mouth breathing. So this is like a massive topic. I see a lot of kids and a lot of adults that are mouth breathing. Now, typically, if you're mouth breathing, you will have a forward head posture. So there is no way that I can mouth breathe comfortably if my neck is and my head is on top of my shoulders. There's a lot of restriction. But if I do this, all of a sudden I can get that oxygen into the system. And there are a lot of things about mouth breathing that we can discuss. But this posture issue can cause a lot of problems, and you see this all the time, I'm sure.
I also see a lot of head wall postures because they are trying to push the mandible out, because it's too far cramped in.
Right. Are you seeing people
sometimes it's shortened up?
And then people are trying to push their
it
jaw.
out.
That's interesting.
So that's what I see, because you see, if I try to jam my jaw in, I have difficulty breathing.
We definitely can't breathe like you. And then if you're congested in the nose, for example, if you have allergies, this is an issue, because then you're forced to mouth breathe. I actually recently did a talk at a local gym, and there was one gentleman there that was like, I just can't breathe through my nose. The bottom line is he's got sinus issues and allergies, and that's something that needs to be addressed in whatever way. All about environmental toxins, because we're exposed to mold, dust mites, fogging. They get into our system, in our kids and our adults, and they wreak havoc. We're getting histamine responses. People cannot breathe through their nose. And then they're breathing through their mouths. The nose breathing habit over the mouth breathing is really essential.
There's a big, huge topic on it. In fact, just breathing and controlled breathing for energy, for controlling your sympathetic nervous system through breathing.
Diaphragmatic breathing.
Controlling your vagus nerve through the breathing technique.
And tongue on the roof of the mouth to stimulate the vagus nerve.
The vagus nerve itself connects to the tongue.
That's it.
So it's very important to work on the tongue itself. It's a whole new thing that we're looking at.
And you're asking about in adults, so there is appliance therapy as well. So we can use appliances to help support.
So which goes in our next topic, which is Homeoblock. And the Homeoblock caught my interest because it's something that can really help. It was, to me, the only appliance that can really help to expand the maxilla. That can help to improve the tongue positioning. Otherwise, because you see a lot of people now, because with conventional orthodontics makes your maxilla smaller because it actually retracts the jaw by removing teeth, and that causes the tongue not to be able to sit properly, and then you have a malocclusion, which is your teeth going all the way because the tongue pushes the teeth out, and then you have flared out teeth and all cross bite forward and all sorts of nonsense. So I'll let the expert talk about the Homeoblock now.
Yeah, absolutely. Well, there's a really great book by James Nestor. You may have heard of it. It's called Breath.
Yep.
And it talks about a lot of things to do with breathing, a lot of aspects of breathing. And I trained with a gentleman called Dr. Theodore Belfer, who sadly is no longer with us, but he invented an appliance called the Homeoblock appliance. The appliance itself is part of a protocol to help you to grow your jaws, to tone your airway, to improve the collapsibility of the airway. There are lots of different aspects. It's an appliance that is worn on the top of the mouth, and it looks like, if you look in children, it looks like an expander. So there's a little screw in the middle that you can open up. The key thing here is there is a unilateral bite block. So there's a little block that sticks out. So you bite on this block when you're wearing it, and the appliance is worn at night. So you bite on this block, and this block replaces in our hard food in our diet, the lost hard food in our diet. So our diets are very soft. So think about today, what you ate for breakfast. Maybe it was like a porridge, or maybe it was something soft. We're just not using our muscles as much as we should be. If we look at ancestral diets, a lot of the Western diet. All of these indigenous diets, they're chewy, they're nutrient dense. We just don't have that in the modern world.
Correct. That's why if you look at now and maybe a generation ago, you know, the jaws, the mandible and the maxilla is actually reduced by about 30%. And eating soft food, eating refined food, and also a reduction in the nutritional value of
that's it. Yeah.
It's caused our maxilla and mandible to get smaller.
Yeah.
That's why even for my kids that are very young, I was very strict about what my kids were able to eat. So at least now when they grow, when they grow up, they still had maybe not as bad. Yeah. So wearing the trainers actually really helped a lot without removing any teeth.
Yeah. I mean, just digressing, but the trainers are very helpful. So they're designed to get your tongue on the roof of the mouth, lips together, and breathing through the nose in a correct swallowing pattern, because this is your field. When all the muscles are working correctly, we have a lovely, nice, broad airway where oxygen can get in freely and there's no constriction. We're reducing like sleep disordered breathing, sleep apnea, all of the snoring issues, bedwetting. There's just a whole plethora of things that come along with this.
The speech changes as well.
Speech changes, and there's something else is tongue tie that we do want to screen for in children and adults, because obviously if your tongue is constricted, the frenum underneath the tongue, you're not going to be able to get that tongue into the roof of the mouth.
Because my son had that issue a bit. But the trainers really helped. So I'm a big believer in definitely the way forward for dentistry is going to looking at how you can actually train the tongue and improve the size of the palate.
Absolutely. And I mean, for kids, if you can get that tongue on the roof of the mouth, it is better than any expander I can describe for you. The force of that tongue is phenomenal.
You know, the problems that we were talking about, TMJ, sinus issues, tinnitus, all these issues are the root cause. Most of it is actually airway restriction. How do we help these adults with the Homeoblock?
So what I do is I will take a full history, so we get a lot of information, probably similar to yourself. I take something called a cone beam CT scan. Now this is a 3D image of this whole area, so we can look at all of the bones, the position of the airway, we can take some measurements, we can see how the jaw has come forward, how the maxilla is this protrude, and all of those things that can contribute to a restricted airway.
And you can measure the restricted airway through a 3D hologram of the 3D scan.
And some of the things that I see when somebody comes in and say, I'm really anxious, I'm not sleeping well, they're like breathing through a straw. It's like some individuals, some adults that I see really have got tiny airways.
Yeah, man, it's like a straw. It's supposed to be a boba straw, but it's not a boba straw. It's actually a small little straw.
It's like 3 millimeters, 3 millimeters. So we sent to ENT. So it's really a multidisciplinary holistic approach. Body work, ENT, like getting all the checks and checking for allergies. You need to be able to breathe well through your nose if you're using a Homeoblock. Then essentially we do a digital scan. The Homeoblock is given to you and you wear it at night. I generally recommend you wear it with mouth tape. This is why it's very important that you breathe through the nose. So lips are not apart at night. We do not want lips apart at night because we want that action. We want the teeth to be coming into contact with that block to stimulate the teeth, to stimulate something called the periodontal ligament that sits around the outside of the teeth, to stimulate stem cells so that we get bony growth in specific areas. So we're not actually expanding the palate, we are growing the palate. So we're not like getting a screw like with kids and opening it up and pushing it apart. we are growing bone in specific areas. And because of that, and because of the nature of the tongue coming onto the palate, we are toning all of these muscles. And then we get a lovely, broader, even 50% increase in that airway volume.
I've read about that, yes. And your cheekbones get a little bit more distinct.
Yeah, I mean, like, it was originally developed, it was like this facial aesthetic scenario of getting more symmetry in the face, because nobody's face is symmetrical. You look at anyone's face, one high is higher, the lip is higher on one side. It's all to do with the sphenoid, actually, the sphenoid bone. It's an internal bone, and this is where everything hangs off, inside the system. And we want to straighten that up. So we get better balance here, we get a better head posture, we get a broader airway, we get better breathing, we get better facial aesthetics. So it's, I mean, I'm wearing one at the moment, and I've had a lot of patients that are wearing them, and it really creates a difference. But it's very important at the same time that people get body work done because of these releases that need to be done as well.
So that's why we talk about the other treatments that can go together with the Homeoblock to actually improve the speed of the healing process. So you would first also you would also correct the head forward posture, I'm sure.
Yes.
Working on, of course, on the muscles that are sitting in all the occipital muscles. You also work on that. I see. How about, I mean, exercises would be more for the tongue, face.
All the myofunctional stuff. There's a whole series of myofunctional exercises that potentially need to be done depending on the individual. So everybody's different. You know, like, you're very different, I'm very different. So what is applicable for you will be different.
Very different, correct. Because it's very, very specific. Myofunctional training is very specific on the tongue. But because I come from a weight training background, so what I feel is that you might not need to specifically work on it, because if you train, you have to stabilize your jaw. You have to stabilize your tongue. And you have to make sure there is an isometric hold. Otherwise, you won't have any strength and power. Because I mean, according to myofascial meridians, right, our body is all connected. Right. There's a front line, the deep front line, how the jaw is affected, right?
Even the teeth.
Even the teeth. For example, that is done actually in this book by Philip Beach called Contractile Fields, where he actually has the orifice, which is very much part of the sensory for the whole body. So there's a lot of study that has been done on it. So what I find is that by working on the contractile fields or on the different planes of the body, you actually hit the jaw in a specific area. However, for people who are sedentary, of course, myofunctional training, like really just focusing on training the tongue, getting it on the roof of the mouth, working on your movement on the tongue sideways and working on the masseter, that can also definitely help. Based on my work, what I've done with people like that, besides on the muscles in the occipital muscles and the jaw muscles, the digastric, the masseter, and because the digastric, I got the vagus nerve as well.
That's it, right?
Right. So all this and the TMJs, as well, releasing the pterygoids and stuff like that. So definitely, it's a real holistic approach to work. But one question is, in bad cases, are there like surgical interventions when you open up the palate?
So that you can do this.
You can do this, right?
I don't do it. It's not something that I do, but it can be done.
But do it in conjunction with the Homeoblock, or? No.
So the Homeoblock, it's very important to come in, have a cone beam CT scan and have a full assessment done before we decide, is it appropriate for yourself? If it is very severe, or you have something like severe sleep apnea, you're using a CPAP, CPAP is a whole other thing. I have 30-year-olds that have come in to see me saying, I'm using a CPAP, and I'm like, we want to try and stay away from, if we can.
Maybe you want to talk more about that, why you would avoid using a CPAP?
So a CPAP basically works by putting pressured oxygen into the system. So you wear it at night, it goes here, and it does work, absolutely. It's prescribed by ear, nose and throat surgeons and specialists to get oxygen into the body when you have moderate to severe sleep apnea. The problem with this is that the air is being pushed into the system. All of these muscles are becoming more flaccid, meaning they are not as toned as they would be otherwise. When we lose the tone in the muscles, we lose the tone in the airway. So it's actually potentially making the situation worse in the long term, even though in those moments you're getting more oxygen around the system and you feel better, which is amazing. And I definitely think it has its place.
It might even weaken the diaphragm.
Yes, this is something else we should talk about, is the thoracic diaphragm and the pelvic diaphragm and how we breathe. Because this is something that's also very overlooked, how the diaphragms work in synchrony. And for some people, paradoxical breathing or the diaphragms are working the opposite way. it's hard, and this is part of the Homeoblock protocol, is retraining how we breathe.
Because a lot of times also when I see why people get gastric reflux, it's because of too much negative pressure in the diaphragm.
Right. Yeah.
And that causes it's stressing out the diaphragm, and that can cause it to be dysfunctional, thus affecting your sympathetic nervous system as well.
And this is it, and we're so like stressed, burnt out. Like we're living in a pandemic of this. Like there's so many statistics. And this is one of the I mean, there are so many reasons, but this is one of them. And if our systems are not working optimally, we're off to a bad start.
Right. Really. Yeah. So what is the time period of wearing a Homeoblock?
It's usually 2 years.
It's usually 2 years, right? Yeah. So, and how often do they have to see you?
So it depends. I have patients that come in from overseas. They take the Homeoblock, they go, I see them like a year later or something like this.
Oh, so who does the turning?
Turn themselves. Yeah. Oh. So this is the mechanism. I know we're jumping around with the conversation. We never finished the Homeoblock conversation. There's so many things to talk about. So I love this conversation because it's really broad. It's, you know, and it's also amazing to work with someone who does body work. Yeah. Because you really
I know what I'm asking.
You really understand the intricacies of it. Yeah. So what happens is you wear the Homeoblock. Now, because you have had bone deposited and bone grown, you turn the screw yourself. There's a little pin. You turn the screw yourself, and then everything stays as it is. And then a month later, you'll turn the screw again yourself. And then, because everything is monthly basis, because everything is opening up, and you can turn the screw. Now, you'll need to come and see me if you need an adjustment to the appliance, if it's not fitting, if something needs a slight little tweak. But for some people, it's absolutely fine. Many of my patients just go, if not, I see you every day.
Okay. Yeah, and also we talked about wearing Homeoblock, you can change the shape of your face. So it's also for aesthetics reason. So this might be a sensitive topic. To change, because a lot of people wear Invisalign for aesthetics, right? It's for aesthetics. I always recommend that the Invisalign may not be a good idea, especially if they remove teeth and they just jam the jaw. Because a lot of people who wear Invisalign is because they have overbite. So by reducing that overbite, you can actually jam up the jaw. It's very important when a person wants to use Invisalign to actually see a proper orthodontic for it, because it can actually restrict your airway. I don't know.
Absolutely. I mean, Invisalign definitely has its place. If you are someone who thinks, I just want straighter teeth, I don't want anyone to look at my airway, I feel like I'm breathing fine, I don't have any issues with sleeping, it might be a good option for yourself. But when it is done, you want to try and avoid, if you can, removing teeth, number one, or removing parts of the teeth, number two. Because we don't ideally, and it depends on the reason that you're having it done, we don't want to restrict the airway by bringing teeth in. So if we're bringing teeth in significantly, and there can be reasons that we do want to do this, such as trauma, you're way higher, especially in kids, you've got way higher chance of trauma if your teeth are coming out like this. But then maybe we need to look at growing the lower jaw. So we need to think very carefully about how the Invisalign is planned. So I'm not against Invisalign at all, and I think it definitely has its place. Even after the Homeoblock, we can do Invisalign because everything is nicely in its arch, just to tidy things up, to bring stability to the bite. That's also very important.
So there is a process that you follow. You just don't go and do Invisalign without actually having a proper check.
Your airway first.
Check your airways, mate.
Check your airway first, because it can lead to, and I have seen it in my adult patients. I had 4 teeth taken out. I had 8 teeth taken out for my Invisalign. I'm just like, and your airway is like a straw.
And not only that, they make the teeth a bit narrower to get more space, so they remove all the enamel.
It can be done.
And that is to me, that you're reducing your airways, and not only that, your teeth can't sit properly, and a whole host of problems come.
And space for the tongue. So we touched on this earlier. So if things are made smaller inside, you've got no space for the tongue, and where does the tongue go? It has to go somewhere. So it's falling back,
and then you get a snoring
potentially. Exactly.
So we spoke about myofunctional therapy and how we can actually work together with a client who has got this airway restriction problems. Okay, so if any of you wants to have an appointment to see Dr. Surinder, she's based at Nuffield Dental Jewel, Wheelock Place. Or you can email her at holisticdentistsg@gmail.com. Thank you very much for this wonderful conversation that we had.
Thanks so much. Great conversation. Thank you.
Yeah.